Gianna Osborn has been to a lot of doctor's appointments. The 17-year-old from Minot has spent the past 4 years being treated for common variable immunodeficiency, which makes her susceptible to infections and autoimmune diseases. This includes chronic ITP, a disease which affects Gianna's blood platelets, organs, and more. Because her disease, and the potential complications that could stem from it, straddles so many different medical specialties, she now goes to a unique clinic at Sanford Health in Fargo, where she can meet with 4 different doctors in 4 different specialties, all at the same time.
At my old appointments, I would have to go over my history and how everything started about 5 different times, and it kind of just got to be a lot. So I definitely like coming here and just being able to talk to all of them at once and hearing how they kind of bounce off each other's ideas, and they kind of just make it all work the way I kind of want it to work.
The Pediatric Immunity Deficiency Clinic within Sanford's Coordinated Treatment Center is the brainchild of Dr. Christopher Failing, a pediatric rheumatologist in Fargo, who saw the benefits of a multidisciplinary clinic during his fellowship at the University of Michigan.
That was my dream, to start something for the Dakotas. We had several patients in the state that already had pre-existing immunodeficiencies, some living very far away. So we thought it'd be great to have a clinic where everyone can come see all the specialists that they need to see at one time, instead of having to come back and forth for separate appointments.
The clinic is held once a month, and the group might see 4 or 5 new patients along with 2 or 3 returning patients each clinic day. It is also unique in the region. In fact, according to Dr. Failing, the nearest equivalent clinic is in Milwaukee, more than 500 miles away. Dr. Clifford Moriello, a specialist in pediatric infectious disease, is one of the many colleagues who have joined the clinic. He says the overlapping knowledge of each specialist reassures the patient and keeps the team on the same page.
Instead of going to 4 different clinics and then everyone getting either part of the story or not all the data, we all have all the data together, all have the same story, and we say, this is the plan that we're all doing together, we made it together, so that there's no doubt in the patient's mind that there's a comprehensive plan of action.
After meeting with the patient, the doctors reconvene to talk about a treatment plan, making sure medications don't conflict while also bringing their own unique perspectives to the table. While all of their knowledge is obviously beneficial to the patient, the doctors themselves get a great deal from these clinic days as well.
I'm learning things every time I'm in this clinic. Being able to have that conversation, that collaboration, that collegiality in person, face to face, it's a rewarding experience.
For Gianna Osborn and her parents, the collaboration between these 4 doctors is something at which they marvel.
Watching them work together, it's magical, and it just gives you goosebumps because you see their minds and how smart they are and working together to figure out what's going on with her. She's doing a lot better, but it can spiral for sure, and you have to stay on top of it.
This is tremendous for Sanford, and more importantly, it's tremendous for the people that we serve here, for our patients, for children, and for teenagers and for young adults.
In Fargo, Jason Anschutz, Sanford Health News.